What is testosterone replacement therapy, and how do you diagnose someone's symptoms as needing testosterone therapy?
We run a clinic called the Optiman Clinic, and guys come to us not because we've advertised, but because they're listening to podcasts from States, guys like Joe Rogan. So the common symptoms are feeling tired, erectile dysfunction sometimes, but low libido is a common one, decreased muscle mass, low motivation to train, slightly low mood or anxiety, and poor sleep. Pfizer did a study a long, long time ago about systemic blood pressures, and they thought if we give something that'll dilate the vessels, that'll decrease the pressure. They gave them huge dose, 800 milligrams of sildenafil. It worked, but not fantastic. But they noticed that the packs from the placebo arm were being sent back, but the packs from the active treatment arm with sildenafil or Viagra in it weren't being sent back. And the reason was they were having fantastic...
raging boners.
Right, they were having fantastic erections. Yes. Okay. And then they dialed back the dose a bit, and that's how Viagra was born.
Do you know that it's also good for period pain, but they just never pursued that avenue?
That's really interesting.
Yeah. Prostate. Can we talk a little bit about that?
How many guys put off going to see the doc for a prostate check because they know they might get an exam? If you're a man and you're alive, you should get your prostate checked. If you ask me, the number one diagnosis I'm making guys who are tired all the time, it's obstructive sleep apnea. The thing about sleep apnea is every minute you have it, you're taking minutes off your life. 9% of patients have Peyronie's disease. I went through medical school, I didn't know what it was. So it's where you get trauma. Now, sexist trauma. What if you've got a little bit of erectile dysfunction? You're more likely to get trauma. They'll get a little bit of damage. What happens with damage? You get scarring. When you get scarring, you get a plaque build up, and the next thing now, your penis, that used to be fairly straight, is now starting to curve up or to the side. Once it goes to 60%, they can't get penetration. So now it's a disfigurement. And how likely are these guys to present to doctors? Even less likely. But there's great treatments out there.